Hi everyone! Today I am sharing a video with everybody about our horse's dental exam. So back in February when we originally got these horses, we had a vet go down to the livestock yard and give them a health check just to see a general checkup to see how healthy they were, to check their legs and their hooves and see what needed to be done. One thing that the vet observed is that all the horses needed to have their teeth floated. So me not knowing what that was, had to ask a bunch of questions and figure out what that was. But basically, horses' teeth grow and change constantly. They continually file down their teeth when they're chewing, but if they don't chew evenly, they can get sharp points or edges which can poke into their gums, causing pain or cuts on the inside of their mouth or just general gum irritation. So basically when the vet said they needed to have their teeth floated, that meant that they needed a dental process to remove those sharp points from their teeth so they could have an even grinding pattern for chewing. So basically we chew up and down. A horse kind of does a side to side or kind of circular motion to grind their food. So if they have those sharp points, it can cause them problems, and also they don't grind their food completely, so it causes problems with digestion. Our vet recommended Sarah Long, who is an equine practitioner, and she's here locally in Amarillo. So she came out to the house back in February, and she took care of Charlie and Miley, and we did them first because obviously Charlie had the choking issue, and on original consultation, Miley had a nosebleed, so we didn't really know what that was from, but it came to find out from the x-ray that Miley actually did have an extra molar, so that'll all be part of this video too. And I wanted to share this with you because I thought it was really interesting about a horse's mouth and a horse's anatomy and everything that Sarah found with all the horses, and this was all part of their health and part of their story, so I wanted to go ahead and share this with you, and I hope you enjoy this. Thanks!
Sarah Long with Long Equine Dentistry, and I'm a certified practitioner, equine practitioner with the International American Institute of Equine Dentistry. So I just go around and help big guys and little guys get their teeth floated, and to where they can live a better life and eat better and live a comfortable life. So that's what I do.
And anyone looking for an equine dentist in this area or equine practitioner,
yep,
Sarah's the one you need to call.
Well, I appreciate it. Yeah, I do travel a lot, so it's a very rewarding occupation. So love to help them.
And you do a great job.
Oh, thank you. Yeah.
Thanks.
Since the horses are so big and have probably never had their teeth floated in their entire lives, I helped Sarah during the procedure just to keep the horses calm and also just to be there for moral support for them. And this is pretty much the process of their dental exam. She started out by rinsing out their mouth with some water and disinfectant. And then she would just give them an evaluation basically to see how their teeth were. And then she started the procedure.
See, you want a letter?
No joke, right?
Let's see how he does.
Oh my god.
Bad?
Mm-hmm.
Very bad.
I'm gonna go to work on his molars first.
This is the inside of a horse's mouth in case you've never seen one. Charlie's initial evaluation was that he had hollowed out teeth and he didn't have much grinding surface. So she was going to do her best to try to get it to where he was more comfortable and actually could eat better. She ground down these surfaces because that's the part of the tooth that actually grows in a horse's mouth.
His lower molars, they're like what we call a ramp, and they're like all the way to the top. Which is not good.
Maybe guess why we choked.
I'm telling you, this
Probably.
guy's already got some stuff going on. Put this in like a kind of a bit would be. Okay.
So this is called a speculum, and this is used to keep the horse's mouth open during the procedure and also for her safety.
We just kind of.
Okay. Those should be like a ½ inch shorter. And then you see his top teeth, how they're cupped out, how they're like this. They should be flat. They're cupped out. Okay, I'm gonna press on this pedal. Help button. Here.
Since I was helping with the procedure, I really couldn't take up-close video, and plus I didn't want to get in Sarah's way or spook the horse or anything like that. But basically what she's doing here is filing down those sharp points that were in the back of his mouth. This was a very long procedure, so this is actually only a short little snippet of each of their procedures. Most of these were well over an hour each. So here she's checking his teeth and talking about the occlusal surface. You couldn't hear the audio because I didn't have my microphones yet, but that's the surface of the teeth that's in contact with the opposing ones. And basically what's happening here is that he's pretty sensitive and he doesn't have much surface of his teeth. And that's due to his age. This was a little ways into the procedure, and so she was giving him a break to get the speculum out of his mouth, to give him a little bit of a rest on his jaw. Here she's checking the surface and the contact that he's actually getting on his back molars that she just worked on.
Doesn't need braces.
They actually can do braces for horses, but normally it's when the incisive bone up here has been fractured and you got teeth sticking out, and they'll go in and wire or even zip tie around the tooth.
Really?
And then wire back to the molars where it pulls it back. Yeah. I'm going to try to do some incisor work while I've got him right here. He doesn't have much surface contact. Like, they're so hollowed out, and that could be part of why he choked. He's not grinding his food up. He can't.
Gotcha.
But I'm going to go back in there in just a minute, and I'm going to do a little bit more work on his molars and getting fixed up. But it's just there's not much there to work with. A little bit. Vibrate. And see, they have a nerve in their tooth, but they don't have nerve endings like we do. And their teeth are continuously growing. So like for me to reduce on their teeth like I am, it does not hurt them. Now if I went all the way and got to what they call the pulp chamber, then you would see blood. But I can gauge where I'm at, So people that don't understand what's going on, does that hurt him? No. And he's just not used to this is why he's being this way. It's not because he's in pain. He's just
I don't like
uncomfortable. And on these incisors, that vibration,
It probably feels weird.
yeah, and tickles.
Charlie has bad teeth. Yeah. Don't walk out here, you'll freak him out.
No, I'm not. I'm coming the other way.
His teeth are hollowed out in the back
She's doing the best she can to get him.
You mean like he has no teeth or just needs
So like his tooth should be like, you know, think of a flat surface and
Yeah.
it's cupped out.
Oh.
So instead of having all of this,
Yeah.
it's like there's no surface to grind on.
That's
It's
probably
like,
why he choked.
yeah.
Poor guy.
Back up, sir.
I'm gonna reduce his canines. That's what this is called. These are canine teeth,
Oh,
and they're sharp. And I'm just reducing it, like
was that
this
this
is
one?
just while I have my hands in there. They're a little sharp on me, and it'll help them too. But mainly why we reduce on these is if they're being brattled a lot. The bit, if they get really big, the bit will hit them, and it's just
Uncomfortable.
yeah, you know, real with it.
Come back here.
I'm gonna spec him up again so you can take your stand.
Okay.
Push pressure down if you can reach.
Mm-hmm.
Yeah, right.
So after a very long procedure, she's checking to see his contact, how much contact he has, and to make sure that she got everything filed down and that he had an even surface. So this was Charlie's dental exam.
You ready? Mm-hmm. I'm just gonna start at the top a little bit, introduce you.
So Sarah's starting to work on her molars in the back, and she's just reducing those down, and that's where she started with Miley.
She need her tongue held back a little bit. Now she.
Don't touch my tongue.
Got it. You're gonna really have to grab a hold of it.
Okay.
And you don't have to like pull against her much. Just
Just like that.
yeah. Just where she won't use on me.
Never can say. I can now say that I felt a horse tongue.
Yep.
Miley was actually using her tongue to push against Sarah's tool, and since she's so strong, that's why she had me hold her tongue.
She's actually got 2 extra teeth, an extra molar on each side, and that's why they're down so far. I was like, and I was counting them on the x-ray, and I was
Yeah.
like, maybe I'm just not counting right, and I'm counting them again. She's got, so it goes 6, 7, 8, 9, 10, 11, normally 12. She's got, so she's got 6, 7, yeah. When she should have
extra
6 through 11, she's got 6 through 12.
This is the x-ray that Sarah's referring to. This was taken from the original vet that was out at the livestock yard. They took this because we wanted to make sure that Miley didn't have anything else going on in her sinuses since she had that nosebleed. But this is where they found that she does have that extra tooth there in the back. So Sarah reduced on those as much as she could to get it so it wasn't actually pushing down into her jaw.
There we go. So that's what's up with that. Let me count one more time. 6, 7, 8, 9, 10, 11. Yep. Damn sure does.
You ever seen anything like that before?
I've heard of it, but I hadn't seen it.
Well, there you go. Take pictures. You have proof now.
Just trying to get them drilled up as far as I can. They're just so big.
Have you ever worked on these horses before?
I haven't. I've worked on some giraffe crosses but they were much smaller.
Yeah.
Gosh dang, those are really
Big teeth.
just that extra tooth has nothing to grind on, for years and years and years, and it's like a good inch, and I'm trying to go and work somewhere else where I'm not getting that tooth hot, and then come back and work on it, and it's just like, so I think that I'm getting headway, and then I'll look at it again, I'm like, real, how big those are.
Half the size of normal horses' teeth, or
It's just how long it's down, that molar. It's like
the extra one.
oh my god, yeah. Like in all honesty, they need to be pulled, but I mean I can't do that. Like they're in there, That would be like putting her under and pulling them. And I'm not saying like I'm getting them reduced up enough, but they're gonna there's nothing for them to grind on. They're gonna keep growing, Your little mustache.
It's okay.
The rest of her mouth looks great.
That's a good one.
Sarah reduced those extra molars down as far as she could so they wouldn't be pushing into her bottom jaw. So she'll come back in 6 months and check them again and probably reduce on them a little bit more. Sarah took care of Charlie and Miley's teeth first, and then we decided to wait until the horse stock that we had on order got here, which is what Cammie is in right now. We decided to wait to do the rest of their teeth just because we wanted to keep them contained in something. This gave them something to lean on, and it was safer for Sarah too as well, working on their teeth. So this is Cammie in the stock. Her teeth were actually in pretty good condition. This is her working on her incisors, but her teeth were in pretty good condition, and she just had to reduce on the front and the back. But other than that, she did not have any of the issues that everyone else had.
She's not bad, but she's real heavy in the very back. Those teeth need to be reduced up, because that's just going to keep creating the wave.
My GoPro cameras didn't actually record Sophie or Aline's videos for their dental exam, but I did have a time-lapse video going for Aline's. So this was hers, but Aline's and Sophie's teeth were actually in really good condition, so she just reduced on the sharp spots in her mouth and did her incisors, but this was just a quick view of Aline's dental.
You want to look at her real quick?
Yeah.
She's actually got a really good mouth. She's got some feed packing
sharp
right here.
though, huh? She hasn't had anything floated.
That's that feed packing I was telling you about.
At first look, Sarah found that Freya had a lot of feed packed in between her tooth and her gums, so that's what she's actually doing here, is removing that.
So that's where she had a bunch of hay feed packed in there. And I don't know, because nothing's mobile there, but it's, yeah, that's painful. See how far down those are going in her gum? That's all the way down in there. I'll hold her straight right there, yeah. Now can you see in there good?
Yeah.
Is my light messing you up?
No, that's good. Yep. She's like, what are you doing? Wow.
Yeah. She's got feed packed up in there too.
Yeah.
See, that's down in her gum like that far.
Oh my gosh.
It's really, I mean, it's got blood on it. And that's just, she's got these spaces. I mean, I know she's got a good mouth overall as far as like everybody else. She's got all her teeth and everything except for here at the front. But I'm gonna reduce the uppers where it'll take that pressure on these lower ones, but still these holes where this hay's getting in there.
How do you fix that?
And maybe not give her hay for a minute and see if
Just do Alpha Pro. Just put her on straight
yeah,
Alpha
just
Pro.
give her see if they'll close up. But I mean, when you turn her out, she's gonna do grass. It's gonna do the same thing.
You couldn't hear the audio in this portion of the video, but what she's saying is that she needed a break from hay for a little while just to get these places where the hay has been packed in her gums, needed to have a little bit of a break. So we put her on Alpha Pro. And after her dental exam, we did take her to the vet to make sure that she didn't have an infection or anything like that in her gums because of these holes from the hay that was getting stuck in there.
I've never really seen like the after part. Like I've never actually looked in their mouths afterwards.
Okay, I reduced these front ones, and I can show you these molars where they won't be. I need to do some more of that one. She's got the best mouth out of all of them. I will say that.
Yeah.
Yeah. So come here and I'll show you what I'm talking about. So like, okay, you see this? This is a number 6 incisor. Molar, and see how now it's not gonna hit that lower one. She had all that pressure. It is very, very irritable. Can you see in there?
Yeah. Yep.
And then same thing on this side. Took the pressure off of this side as well.
Oh, okay. Yeah.
So now some of that hopefully will tighten up.
Okay.
And that might even, I'm not going to say that'll cause the cure for that hay getting down in those holes.
Right.
But, she was grinding it down in it.
Right.
And
so it'll help.
I think you could probably like I would not give her hay for a couple of days.
Okay.
Let those holes kind of heal up.
Okay.
And then I would let her have some. I'm not gonna touch her incisors. They're not even touching, so they're not sharp or anything.
Okay.
I'm just gonna.
Oh, her poor
It
little
is how it is.
key. So is that just from old age then?
Some of it, there's no telling like how she was having to eat.
Right.
Just when I see it, I think of cribbing, but y'all say she isn't cribbing here, so, and it might have been from like, the stressful situations to where now she's not in a stressful situation, so she might have been cribbing out of stress, and now she's here and has food and doesn't have to worry about it, and doesn't do it now. That's one possibility.
She likes her hay, I'll tell you that much.
Yeah, of course. But definitely, and I doubt that it's been dental work done.
Yeah, I don't.
I want to be like, well, maybe somebody overworked her or something, but they look like they've definitely been worn. So, but
Poor baby.
good girl.
After Freya's dental exam, she stopped eating hay. She had hay packed in between her teeth and her gums, causing some holes. So we actually brought her to one of Sarah's colleagues just for a second opinion to make sure that everything was good with all her teeth and her gums and everything was healing up properly. And he found one little high spot, so this was actually them fixing the one high spot. But we're still waiting for her to eat hay. Her teeth are probably still a little bit sensitive because she had never had them taken care of before, but she's on the road to recovery. Hope you enjoyed this video, and thanks so much for watching.